Hello, everyone, and thank you for checking us out. This is SAC Health Answers, an opportunity for us here at SAC Health to answer your questions about health so that you can make decisions that will have a positive impact on your health and wellness. I'm Dr. Jason Lohr. Many of you may know me as the CEO here at SAC Health, but I'm also a practicing family medicine physician. And today we have a question from Frank. And Frank asks, I'm a 50-year-old male with a history of heart disease and diabetes. I'm trying to improve my diet, and I was wondering what kind of foods I should absolutely avoid. Well, this is a great question, Frank, because diabetes and high blood pressure and heart disease are very, very common in our environment, in our community, and a lot of people have a question about what they can eat or should not eat related to their diet and everyday choices that they make at the dinner table. Let me tell you that there are certain things that we really recommend people to avoid or at least eat less of. And those are typically items that contain a high amount of fat. And so you may think, well, I don't know what is fat. Well, fat is typically things like oil and grease. And when we talk about food that has a high amount of fat, we're typically talking about foods that come from beef or pork or chicken, even fish to some degree, all have fat in them. And the more we're able to eat plants or food that comes from a plant source, the less fat. In fact, there is very little fat in plants, and there's a pretty high amount of fat in most things that are from animals. The main recommendation is to have less of an animal products and more of products that come from plants. That is always the healthiest. Now, if there's also diabetes that is going on, we also want to avoid foods that are really high in processed sugar. And so that would include things like sodas, which is at least sodas that are not diet sodas. They have a high amount of sugar, concentrated sugar. And so you're drinking that directly. In 5 minutes, somebody can drink over 40 grams of sugar. That is way too much for somebody who has a history of diabetes. So we recommend really nothing with processed sugar, especially drinks and soda, and even juices that could have processed sugar added to them, we really want to avoid. So those are the things to look out for with diabetes and with heart disease. Frank, I hope that helps to answer your question. If you have more questions, please connect with your primary care physician. They are the partner in your health, and we always recommend if you have any questions, come and see us, either at SAC Health or with your primary care doctor. Thank you for joining us for this episode and hope to see you next time at SAC Health Answers.